this lecture, we're going to talk about bioavailability and factors affecting it. So, to learn about this aspect, let's begin by looking at a case of a patient. So this is the prescription of Miss Alice. She happens to be a 19-year-old female, and she presented with a complaint of acute migraine, which is a cluster headache, which is very severe pain that the patient feels. So she had acute migraine. She visits the physician, and she, the differential diagnosis she had aura and pain. And so the physician determined that she was indeed suffering from acute migraine, and he prescribed this agent, sumatriptan. Basically serotonin agonists, and specifically in this case sumatriptan acts as a 5-HT1B agonist. So this drug was prescribed to 50 milligram. It's a tablet. So tablets are available as 25, 50, 100 milligram doses. So this is a tablet, and the patient has been asked to take a tablet for a day. All right. So sometimes migraine is associated with vomiting. So since this patient has been given a drug orally, the tablet is given orally, it's administered orally, we can infer that the patient is not vomiting. So had the patient been vomiting, then the parenteral route of administration would have been chosen by the physician. Okay, so this agonist, a tablet, was given to this patient, and the patient was asked to take one tablet a day, presumably in the morning. So meaning this is, yeah. So the patient was asked to take it in the morning. Now, let us follow this patient, okay? And we can ask this patient, we can ask consent. And let's imagine that we are subjecting this consenting patient to an experimental protocol. Okay? So what we're doing is, we are going to administer the drug, and we're going to draw blood from the time of administration. And we're going to check this drawn blood. We're going to assay for sumatriptan. So we're going to draw the blood at intervals of time, say about 15 minutes. Okay. So every 15 minutes we're going to draw blood from this patient, and we're going to assay those samples for sumatriptan, the drug. Okay. At the the same time, we're going to interview this patient with regards to the relief of pain. And the data that we obtain, we're going to put it into a graph. Okay. This period graph. And what we're going to plot is time. It said we're going to draw blood every half an hour. So let's mark that. Yes, every half an hour. And on the y-axis, we're going to plot the concentration of the drug. So this is concentration of the drug in blood. And this is the time. This is 30 minutes. Let's plot in what we obtained. Okay, so this is the graph that we obtained by plotting all the points. So maybe an hour. This is the concentration. Half an hour, that's the concentration. Okay. This is 30 minutes. Okay, and so on. This is minutes. Time in minutes. And concentration, say it's nanogram. Okay, and this is what we get. Right. Let's give it a more realistic definition. Okay, so the time where we get the maximum concentration, that's called Cmax, and the time taken to attain Cmax is called Tmax. So the time to attain the maximum concentration is Tmax. And as we mentioned earlier, we're going to talk to the patient. We're going to ask the patient. Let's say this is loaded here. All right. So we have been asking the patient about the pain relief right from the time we administer the drug. So at 0 time we administer the drug. The tablet is given at 0 time. And every 15 minutes we are drawing the blood out and we are asking the patient, are you feeling any pain relief? Okay. And at 30 minutes the patient tells us that description of what we say. Okay. So let's say the patient tells us that at approximately 30 minutes the patient is beginning to feel relief from the pain. So the concentration at which the patient begins to feel relief of the pain, this is called minimum effective concentration. Okay. Right? So for the patient to find relief of pain, it should pass a threshold, and that threshold is called minimum effective concentration. Only if the drug concentration is above MEC would the patient feel relief from pain. So all the concentration below MEC, this is called subtherapeutic. Okay. So suppose the patient was given maybe say 5 tablets, okay, an overdose. What would happen? The concentration would shoot up and the patient will show signs of toxicity. So the threshold over which toxic concentration is seen, or the beginning of the toxic concentration, is called maximum safe concentration. So if you cross this threshold, you're going into, you see toxic effects. Okay, above MSC you find toxic effects. And when you touch the line also you might find some toxic effects, but that's the maximum safe concentration. Okay? Beyond that, it is a genuine toxic effect. Okay, so for the drug to be effective, the concentration of the drug needs to be between MEC and MSC. Okay. The concentration should be within this window, okay, between minimum effective concentration and maximum safe concentration. Okay, so this is called the therapeutic window. So the drug has to be in the concentration should be within the therapeutic window, only then will the drug have an effect. Okay. So the maximum concentration that is reached is called Cmax. After that, the concentration reduces. So let's see what's happening actually. So the tablet that the patient has taken, it's taken orally, so it goes into the GIT, it undergoes disintegration and dissolution. And then there is absorption. So after absorption, what happens? After absorption, so let's write it down here. The tablet undergoes breakage. This is called disintegration. Then the drug dissolves in the GI fluid. Okay. This is called dissolution. Then it gets absorbed. Okay. Then it goes into the hepatic portal system. So it is absorbed into the liver, and then the liver, it undergoes metabolism, and the metabolite gets into the blood. Okay. The entire drug doesn't undergo metabolism. In case of, here we're talking about sumatriptan. So for sumatriptan, about 54% of the drug undergoes metabolism, approximately 54% of absorbed. So the rest reaches the blood. Okay? So this area here, if we integrate this whole area, if we calculate the area under the curve, so this is called area under the curve, and we depict it by F. Okay? So area under the curve is the fraction of blood, fraction of drugs the patient has taken, say. So the patient was prescribed 15 milligram dose. So let's say the patient has taken 50 milligram this area under the curve depicts the concentration, entire concentration that reaches the blood, and it is found to be about 14%. 14%, and that is 14% of 50 milligram. Okay. So that is 14. So approximately 7 milligram. So we have administered 15 milligram, and from 15 milligram, 70 milligram has reached the 7 milligram has reached the blood, and that 7 milligram is responsible for the therapeutic effect. So the patient feels relief due to the 7 milligram that has entered the blood, and the fraction of blood above the minimum effective concentration is what is bringing out the therapeutic effect. Okay? All right. So the patient tells us that after we've been interviewing, and the patient says after 30 minutes that the patient has begun to feel relief. Okay, so that is called the onset of action. So in this case it is 30 minutes. And what has happened in 30 minutes is that the concentration of the drug has reached above MAC. Okay. Concentration reaches above MAC. Okay. So when does the patient say I am beginning to feel relief? When the concentration reaches above minimum effective concentration. So the time required for the onset of action, whatever happens to the drug, that is called the absorption phase. Again, so the drug is increasing in the blood and it is reaching Cmax. This phase is called the absorption phase. Okay, after absorption it reaches Cmax. Then we said that it is metabolized by the liver, and the metabolite goes into the blood, and from the blood the metabolite goes into the, through the blood it goes into the kidney, and the kidney filters it, and through the kidney it is excreted. Okay, so when the drug, as the drug is increasing in concentration, it is also undergoing elimination. Okay, so it is being removed from the body. So that is why the concentration begins to reduce. Up to here it's increasing, and after reaching Cmax it's going to reduce. So why is it reducing? Because it's getting metabolized and it's getting excreted. Okay, so that is the excretion phase. So we have an absorption phase and we have an excretion phase. Okay. So the doctor has asked the patient to take, the physician has said you have to take 1 tablet for 1 day. So the time from the onset of action to the time where the concentration goes below the MAC, this time is called the duration of action. This would be 4 hours. So 5 hours. Okay, so in this diagram it's about, in this graph it is about 5 hours we find the duration of action. Sumatriptan, it has got another phase. Okay? The original drug sumatriptan, its curve kind of goes back again, and there is another peak, and then it begins to reduce. Okay? So the drug effect lasts for about 24 hours. Okay? So we have simplified the concentration time curve for the sake of understanding. Actually, it's about the duration of action is about 24 hours. So that's the reason why the physician asked the patient to take just 1 tablet. Okay. What we understand from our discussion here is that from about 50 milligram tablet, 7 milligram entered blood and most likely has been responsible for the therapeutic effect. So we administered 50 and out of that 7 reached the blood. What happened to the rest? So a part of it underwent metabolism, a part of it underwent elimination, and a fraction of it was not absorbed. Not absorbed from the GLT. Okay. So that's the reason from 50 milligram only 7 reached blood. Okay. The fraction that reached the blood, okay, that is called bioavailability. Okay, so now we are going to define what is bioavailability based on the concept that we have learned here. Okay? So we said it's the fraction of drug that reaches the blood after administration. So let's formally try to define it. Okay? So bioavailability is defined as the percentage of administered dose which reaches the systemic circulation in an active form following non-vascular administration and is thus available for distribution to the site of action. So based on the concept, we can now define what is bioavailability. So bioavailability is the percentage of administered dose. So we administered 50 milligram and 14% of that we found in the area under the curve. So remember, under the area of the curve, what we found was it was found to be 14%. Okay? So what is the bioavailability of sumatriptan 50 milligram? So sumatriptan 50 milligram, the bioavailability of the F equal to 14%. So the bioavailability of sumatriptan in the patient, we have found it to be experimentally about 14%. Okay, and that is the definition of bioavailability. It is the percentage of administered dose which reaches the systemic circulation in an active form following non-vascular administration and is thus available for distribution to the site of action. Okay? What do we mean by in an active form? So sumatriptan, we said, undergoes metabolism to form the metabolite. Okay. This metabolite is not the active drug. Okay. Sumatriptan is the active drug. So it is not talking about the metabolite, it's talking about the active drug. In this case, sumatriptan, that is available to the body after administration. Okay. Following non-vascular administration. What is non-vascular? So what is vascular? Vascular means blood vessels. So when you administer something directly, if this is the blood vessel and you are injecting the drug directly into the blood vessel, then this is called vascular administration. Okay. But in this case, we are giving it as a tablet. Okay. So tablet is an oral administration. It is non-vascular. Okay. Tablet is non-vascular. Okay, we are giving it orally administering it. Okay. Following non-vascular administration and is thus available for distribution to the site of action. So we need to remember that when the drug enters into the blood, it undergoes metabolism, it undergoes elimination, and then only it reaches the systemic circulation. Now, if we directly inject it into the blood, then the bioavailability is 100%. Okay? So if it is vascular administration, then the bioavailability is 100%. So F will be equal to 1. Why? Because what is bioavailability? It is the percentage of administered dose. So if 100% of the dose, so F would be 100% of the dose reaches. You have administered 100% of the percent of the drug, and 100% reaches the blood circulation, then F will be 1. So for vascular administration, F would be 1. Okay, so we need to remember. Okay. So if it is non-vascular administration, because there is loss by elimination and metabolism, okay, for non-vascular administration, the bioavailability will be less than 1. Okay, so for per oral administration, the bioavailability for F will be less than 1. Okay, so by definition. Okay, so now we know what is bioavailability. Okay, so for intravascular IV it will be 100%. Okay. Right. So now we know the importance of bioavailability. What is the importance? Bioavailability is the fraction that reaches blood, and it is that fraction that is responsible for the therapeutic action. So that is why bioavailability is important. A drug with greater bioavailability will be better. Okay? So that is the concept of bioavailability. Let us now look at the factors affecting bioavailability. So the factors influencing bioavailability can be classified as being related to the drug, the dosage form, the conditions in the GIT and the gastrointestinal tract, the systemic elimination, which is the first pass metabolism. So whatever we take as a drug, it goes into the hepatic portal system, it goes into the liver and gets chemically modified, and then it gets eliminated. So that is systemic elimination. And drug interactions. So we'll be taking up these factors one by one, but have in mind that we would be emphasizing on oral bioavailability. Okay? So there are other routes from which we can have bioavailability, like subcutaneous or intramuscular, and so on and so forth. But in this discussion, we're going to limit ourselves to the factors influencing oral bioavailability. Okay, so that is, we're doing this to maintain brevity of our presentation, but the general principles remain the same, though if we look at individual absorption sites like the subcutaneous site and the intramuscular sites, there might be some other local factors which influence bioavailability, so you need to look into that. Okay, so we need to look into that when we consider bioavailability as a whole. Okay, so having said that, we're going to discuss bioavailability, the factors influencing bioavailability as it pertains to the orally administered drugs. And so the first factor is the drug itself. Okay, so let's take that here somewhere, and let's try to discuss the pertinent factors of the drug that influences bioavailability. Okay. Okay. So let's consider the drug. Let's say there is this person who is consuming this drug, and the drug passes down his GIT and enters into his stomach, and from there it enters into the intestine. Okay. So what we are considering is this person who has taken a pill, and this pill he takes in through the oral route, and it travels that ways, and it makes its way into the intestine, and from the intestine it gets absorbed. Okay, so if it's highly lipophilic, then it would be absorbed into the lymphatic system, and otherwise it would go into the blood. And from the blood, as we said, it would enter into the hepatic portal system, it will go into the liver, it would get metabolized, and then it will go into the systemic circulation, again blood. Okay, so that's what we are considering here. So what happens to this pill is that it gets into the stomach, and here we have got the GI fluid. And what's the property of the GI fluid? It is aqueous. So it reaches into this aqueous environment, and what happens to the pill itself? It kind of becomes smaller particles, and those smaller particles, when it forms smaller particles, we say that the pill has undergone disintegration. Okay, after disintegration, what happens is it dissolves. Okay, after it gets dissolved, only it gets absorbed. Okay, so it undergoes disintegration, it dissolves, and then it gets absorbed. So the idea is that any drug, it needs to dissolve in the GI fluid. Okay, so it should have what we call aqueous solubility. Okay, so one property would be that the drug should have aqueous solubility. Only then would it dissolve and then be absorbed. So let's consider what happens in this area, and for that let's blow up this area. So that would be the lumen of the intestinal area, and let's consider this particular area, and let's imagine that we are viewing this area under a very high power microscope, and what we see a microscope that resolves it to the cellular level, and what would be maybe subcellular level. What we would observe, what we would see would be the cell membrane out here. Okay, so that is the cell membrane, the bilayer. Why bilayer? Because there is this one layer and there is this another layer, and that's a bilayer, and that is the structure of the cell membrane. Okay, so this drug, we said it has already dissolved, and this drug, it should have an affinity for the polar region. So if we consider this structure here, this is hydrophilic, and this is a lipid environment. So for the drug to be absorbed, it needs to traverse this membrane. The drug needs to pass through this membrane, so that would require the drug to have a little bit of aqueous solubility, which we covered, and it should have lipid solubility as well, because the tails here are made of lipids, so it should have a fair bit of lipid solubility. So it should have these two properties. The second property would be that it should have a little bit of lipid solubility. Okay, so let's write it down somewhere here, that we need two properties. It should be lipophilic and it should be hydrophilic. Okay, a drug for oral administration should have these two properties. Okay, it should have a bit of lipophilicity and a bit of hydrophilicity. So the ratio between the lipophilicity and hydrophilicity, the ratio, this is called partition coefficient. And this is represented by the capital letter P, and this P in turn, so what is this P? So P is the concentration of the drug in the lipid part of the membrane divided by the concentration of the drug in the aqueous environment. Okay? So how do we do this experimentally? How do we determine the partition coefficient of a drug experimentally? So for that, intuitively we know that we need an aqueous medium and we would need a lipid medium. So imagine we take a separating funnel. Okay, a separating funnel like so, and into this separating funnel we add an aqueous medium, which could be water, and we could add a lipid medium. Usually it's octanol. Okay. So these two would be added, and then we would add the drug herein. Okay, and so obviously these two layers are immiscible, right? So we put the drug along with this solvent system, and we shake it, and what would happen is that the drug would partition to the water layer or the lipid layer depending upon its chemical property. And then we could allow the whole system to settle. And if we allow the whole system to settle, we'll have a phase separation. We'd have a water layer, and we would have a lipid layer above the water, say. Okay? And then we could separate the lipid layer, we could separate the water layer. Now this would depend again on the density of the lipid, right? So here I'm assuming that the lipid density is less. And if it's less, then it would float on water. And then, okay, so the idea is that you can remove the water, you can remove the lipid, and then in those layers we could assay for the drug. We find the drug concentration in the lipid layer, we find the drug concentration in the water layer, and then we divide it, and then we would get the partition coefficient P. But when we do this experimentally, we find that P has got exponential values. Okay, meaning we get a very large numerical value. And so to make it easy for computation and representation, we usually express the partition coefficient as in the logarithmic form. Okay, so log P. Okay. So log P is how we depict the partition coefficient. Okay. Now this log P, if it has got a negative value, okay, if the value of log P is negative, it means that it is highly water soluble. Okay, if it's 0, it would mean that it is equally partitioned. Okay, so it is equally partitioned between the lipid layer and the water layer or the aqueous layer. Okay, and if it's positive, then it would mean that it is more lipid soluble. Okay, so it's a ratio. So we are talking in relative terms. Okay, so it's more lipid soluble. All right. Okay. So for orally absorbed drugs, so if we administer drugs orally, then ideally log P should be less than 5. Okay, how do we know this? Because there is an empirical rule called the Lipinski rule of 5. Okay, Lipinski rule of 5. This is an empirical rule that tells you about the conditions under which chemical drugs would be orally bioavailable. Okay, so one of the requirements of Lipinski's rule of 5 is that the log P value be less than 5 for an orally administered drug. So what's been seen experimentally is that for drugs which need to cross the CNS or the blood-brain barrier, the log P value should be around 2. Okay, and if it's administered orally, ideally, in an ideal world, it should be between about 1.35 and about 1.8. Okay, so between that, if you have a value of log P, then that drug can be administered orally. And if we need to administer it sublingually, like for nitroglycerin, then the log P value should be greater than 5. Okay, meaning it should be highly lipid soluble. Okay, so plus 5 would be highly lipid soluble. So if it's highly lipid soluble, then the drug can be administered sublingually. Okay, so that is kind of a rule of thumb. So let's now plug in some real world data and see how it compares. Okay, so let's take a drug and let's say this is the log P, and for the drug let's take a drug, for example, oxytetracycline, and this is minus 1.12, and for aspirin this is 1.19, this is plus and that is minus. Okay, okay, that would make it that would remove the ambiguity there. Okay, so for aspirin it is plus 1.19, and for oxytetracycline it's minus 1.12. And let's take another example. So let's say lidocaine. Okay, lidocaine is a local anesthetic, but it's also given as an antiarrhythmic drug systemically. Now, for this, we find that it is 2.26. And what's the application? Let's put this in context. So for the drug to be orally bioavailable, it should be between 1.35 and 1.8. But here we see that lidocaine is highly lipid soluble. Okay, but we need it for systemic action. So if we give it orally, it's not going to be absorbed significantly because its value is more than 1.8. So how do we administer lidocaine? We would administer it parenterally. Okay, so that is the importance of log P and the relation between log P and bioavailability. Okay, oral bioavailability. So to reiterate, a drug should ideally have a log P value between 1.35 and 1.8 for it to be orally bioavailable. Okay, so that is one of the most important factors of the drug which influences its bioavailability. Okay, so what is the first factor that we considered? The first factor that we considered is number 1, let's write, and it is partition coefficient. Okay, and it's P. Okay, so the first drug factor that influences its bioavailability is partition coefficient.